Thank you, Governor. Good afternoon, everyone. Thank you for being with us today. I'll start with an overview of the data. We have 181 new COVID-19 cases to report today. There are 271 patients who are currently hospitalized, and of those people, 65 are currently in the intensive care unit, and 42 of those 65 are on a ventilator. We unfortunately have 6 additional COVID-19 associated fatalities to report this afternoon. 1 person was in their 70s, 2 people were in their 80s, and 3 people were in their 90s. As I said yesterday, we are encouraging everyone to try to take a moment of prayer or reflection at some point in the day to support those who are dealing with the loss of a loved one right now. Because the governor spoke a little about summer camps and sports, I want to spend a moment briefly talking about children and COVID-19. While there's a lot we're still learning about COVID-19, we do know that children don't appear to be at as high a risk. Fortunately, we've had a smaller number of COVID-19 cases among children here in Rhode Island, and this has been the experience of most other states as well. The children who have had COVID-19 across the country have generally shown milder symptoms. Those symptoms have often been a fever, runny nose, or a cough. However, it's still incredibly important that we teach our kids what steps they can take to help stop the spread of viruses. It's even more important, particularly on a beautiful day like today, to make sure that we are modeling for our kids the measures that need to be taken to stop the spread of viruses. Children should wash their hands often using soap and water for at least 20 seconds. This is especially true if a child has been in a public place. For a lot of children and adults, singing or humming "Happy Birthday" twice is the easiest way to know how long 20+ seconds lasts. Another note that I want to make that is so important is that we create opportunities for communication with the kids in our lives about what is happening in the world. You may have heard news reports about a possible connection between COVID-19 and a health condition in children currently called pediatric multi-system inflammatory syndrome. Doctors around the world and here in Rhode Island are watching this very carefully and trying to learn all that we can about it. It may be thought to be similar to other childhood conditions such as Kawasaki disease, but this is thought to be somewhat differently, particularly because I am an infectious disease doctor for both adults and children. We benefit as a state from having a very close relationship with our providers in infectious disease, critical care, immunology, watching closely what's going on with this illness. We're meeting just today even to make sure that we are all on board, and there's already an active plan led by our colleagues at Hasbro Children's Hospital about how we will prepare for and be ready to respond extensively and appropriately to this if we were to need to here in Rhode Island, while we have not had any confirmed cases as of yet. As we work towards communicating with children the news that you're hearing here every day and what's accurate, it's important to know that not every child is going to want to talk about COVID-19, and that's fine. But it's still important to give children space to ask questions and to express their fears. It's also really important to be aware of how your children get news and information, especially older kids who can go online. You really want to make sure you're steering them towards age-appropriate content. Talk about COVID-19 is everywhere today, so helping children process what they are seeing and hearing all around them is incredibly important. This can help alleviate some fears and anxieties that adults sometimes don't even know is present in the kids in our lives. Open communication is extremely important with our children generally, but this is especially true at a time like this.